Okay, and I'll show you the room. Hi Cole, my name is Nathan. I'm a student nurse practitioner, and I'm going to do a head, ears, eyes, nose, and throat assessment on you, if that's okay.
Yeah, sure.
Okay, so I'm going to wash my hands. So, can you tell me your name and your date of birth, please?
Cole Smith, and I was born November 12th, 1998.
Okay. So when Cole walked in, his gait was steady, he's got good posture, his nutrition looks good, and he appears as stated age. So what brought you into the hospital today, Cole?
I've been having some dull headaches in the morning and some hearing and pain issues in this right side.
Okay. So if you could describe the pain in your right ear, how would you describe it?
Kind of dull and aching.
Okay.
And it's kind of affecting my hearing a little bit.
Okay, good. Any drainage from your ears?
No.
Okay. How would you describe your headache, and what would you rate the pain?
It's kind of like a same sort of like dull, mild pain.
Okay.
Probably like a 5 out of 10.
5 out of 10. Okay. All right. So I'm going to get your vitals here before we start. So I'll stick this under your arm. Okay, so your temperature is 98.0. Your blood pressure. Okay. 112/72. Okay, respiratory rate 16, heart rate is 56, and pulse ox is 96% on room air. Alright, so looking at your skin, there's no obvious lesions, there's no bruising, there's no ulcers, skin is warm, appropriate for ethnicity. Okay, so I'm going to palpate your head here. There's no obvious lesions right now, just looking at your head, but I'm going to palpate it. There's no masses, no lumps or bumps or bruising. Okay, so I'm going to check your temporal mandibular joint. So if you could just chew a couple times for me. Okay. Any pain with that? Any discomfort?
No.
No? Okay. All right. So I'm going to start with your ears here, okay? So I'm going to look in your left ear. So looking at your left ear, there's no redness, there's no drainage, there's no edema noted in your ear externally. So I'm going to look internally. Okay, a little bit of pressure. Okay, so I'm able to visualize the tympanic membrane. The canal is intact, there's no obstructions. I can visualize the components of the ear and no redness. Alright, so I'm going to go over here on the other side. So looking at the external ear, there's no redness, there's no drainage. There's no skin issues. Okay, so looking in the right ear, the tympanic membrane is inflamed. It's red. I'm not able to visualize the components of the ear. There's no drainage noted in the canal though. Okay. So what I'm gonna do is the Weber test. So I'm gonna put this on the center of your forehead, and you tell me if the sound is equal or louder on one side or the other, okay?
It's louder on the right side.
Louder on the right side, okay. So for the Weber test, he has lateralization to the right. So I'm gonna do the Rene test. So I'm gonna hit this, and I'm gonna put it on the bone, the mastoid bone. You tell me if you can hear it, and then when it stops, and then I'll put it in front of your ear, and you tell me if you hear it and when it stops again, okay? All right, so on the mastoid on the left, can you hear it?
Yeah.
Okay, so tell me when it stops.
No.
Can you hear it?
Yeah.
Okay, so tell me when it stops.
No.
Okay, good. All right, so we'll do the same thing on the right. On the mastoid bone, can you hear it?
Yeah.
Okay, tell me when it stops.
No.
Okay. Can you hear it?
No.
No. Okay. So he had a positive Rene on the left and a negative on the right. Okay, so we're gonna move on to your eyes. So looking at his sclera and conjunctiva, it's white. There's no redness, no ciliary flush, no drainage noted. All right, so I'm going to take my ophthalmoscope and I'm going to examine your eyes. Okay, so I got to get kind of close here. Okay. Looking at your left eye, if you can have a big line. Okay. So, able to visualize the optic disc. There's no hemorrhages. There's no exudate. Able to visualize the macula. Looks good. We'll do the same thing over here. Okay. So, looking at his left eye, able to visualize the optic disc. There's no hemorrhages, there's no exudates. Able to visualize the macula. Okay, looks good. Okay, so I'm going to go to your nose here. Now looking at your external nose, there's no redness, there's no skin issues, there's no edema, no visible drainage. So otoscope, I'm going to do the same thing, look in your nose, okay? If you can lean your head back just a little bit for me. Okay. So looking at his right near, it's patent. The turbinates are not enlarged, not inflamed. And there's no deviation on the right. Same thing over here. So there, airway is patent on the left. No enlarged turbinates, no drainage, no redness, no deviation. Okay. So now we're going to move to your mouth. So looking at your mouth, externally there's no drainage, there's no redness, there's no swelling of the lips, no lesions. So I'm going to have you open your mouth for me. Okay. So buccal space is pink and intact. Mucosa is pink intact. Palates are intact. He's got good dentition. Can you say ah?
Ah.
Okay, so we still got his tonsils. They're not inflamed. No drainage, no exudate. One more time. Okay, the pharynx is pink and intact. No redness. Good. Okay, so now what I'm going to do is I'm going to check your sinuses. So I'm going to put a little bit of pressure on different spots on your face here, okay?
Okay.
So tell me if there's any pain or tenderness here.
No.
Okay. So the maxillary sinuses are not inflamed, not enlarged. What about your ethmoid? Any pain?
No.
No, they're not enlarged. Okay. And then the frontal? Any pain?
No.
No. Okay. Frontal sinuses are not enlarged either. Okay. So now I'm going to check your lymph nodes. So kind of the same thing would be palpating kind of all over your face here. Okay. I'm doing it bilaterally. So tell me if there's any tenderness where I'm pressing. Okay. Okay. So the pre-auricular lymph nodes, I'm not able to palpate. Any pain?
No.
No. Okay. Post-auricular lymph nodes, I'm not able to palpate. Any pain?
No.
Okay. Occipital, I'm not able to palpate. Is there any pain?
No.
Okay. So we'll go submental. I'm not able to palpate. Is there any pain?
No.
Okay. Submandibular. Is there any pain?
No.
Okay. I'm not able to palpate those either. Okay. Tonsilier. Is there any pain?
No.
Okay. I'm not able to palpate those. Alright, we'll go anterior cervical. I'm not able to palpate. No pain.
Nope.
Okay. Posterior cervical. I'm not able to palpate. Is there any pain?
Nope.
Okay, so we'll go deep cervical. Is there any pain?
Nope.
Okay, I'm not able to palpate those. And then supraclavicular. Is there any pain?
Nope.
No? Okay. Okay. So I can't palpate those either. Okay, so one health maintenance for you. You do have a significant family history of hypertension and diabetes, as well as hyperlipidemia. So those are issues that can lead to heart failure and coronary artery disease. So I would recommend to exercise and diet. So eating a healthy diet and exercising 3 to 4 times a week would be appropriate to help combat that.
Okay.
Okay. Well, thank you for letting me examine you. I'm going to wash my hands and I am going to give you some time in the room, okay? Okay. All right.